everyone, I'm Nili Solomonov from Weill Cornell Medicine in New York. And today I'm going to talk about why sometimes psychotherapy doesn't work and what can we do about it. First things first, psychotherapy works most of the time. There is strong scientific evidence showing that psychotherapy reduces psychological distress. A recent meta-analysis of 101 studies with over 11,000 patients showed that psychotherapy is as effective as medication. Another meta-analysis showed that patients who receive psychotherapy have 61% less chance to deteriorate than those who don't. However, as we all know, sometimes psychotherapy doesn't work, and some patients may even get worse during treatment. So, what are some warning signs? How can you know and predict who will not get better when they come into therapy with you? Psychotherapy is a relationship between two people, the patient and the therapist. When we talk about warning signs, there are some things to notice about the patient when they begin therapy. There's also some things that you can notice about yourself as a therapist, and about the therapeutic relationship as it evolves. So let's start with the patient. In a recent study using machine learning algorithms, we found that the most important warning signs for patients are negative treatment expectations. So, for example, not believing that therapy will work, feeling extremely socially isolated and unsupported by significant others in your life, presenting with high neuroticism, which is the tendency to respond disproportionately to stressors. And in another meta-analysis, Newton, House, and colleagues found that history of disruptive relationship and interpersonal difficulties in the context of a personality disorder diagnosis predicted negative outcomes. So we spoke about the patient, but what about you? What about the therapist? Heinonen and Nissen Lee identify certain patterns and feelings that may serve as warning signs. For example, if you experience insecure or fearful attachment with others in your life, if you have a tendency to avoid problems in your sessions and outside of therapy, and if you experience constant self-doubt and low therapeutic skills, or the opposite, feeling overly confident. When you have a strong belief when you don't have a strong belief in the curative power of therapy, and that happens sometimes to all of us, but that's something to notice. Jamie and his team found that burnout could be a warning sign. And we know that especially during these times when a lot of us therapists are still working from home and seeing many patients on Zoom. And Jamie has a blog about that and what you can do to tackle burnout. In session, notice warning signs as part of your own countertransference or your reaction to the patient and the session. In a meta-analysis, Hayes and colleagues found that your countertransference can have significant negative effect on patients' outcomes. We also know from the previous review that I mentioned that when you have difficulty respecting or liking the patient, or if you have a hard time tolerating their emotional needs, that can be a warning sign. If you're overly bored, tired, anxious, if you feel like the sessions don't have that flow, that things are really stuck. So taken together, these therapist and the patient factors can affect the relationship. And we know that a poor therapeutic relationship predicts worse outcomes. So when thinking about the therapeutic relationship, notice if there's a sense of instability. If there's many moments of misunderstanding or lack of flow or a sense that you and the patient are not on the same page. And Martine just did a vlog about that and focused specifically on alliance ruptures and what they mean and what can you do about it. We know that differences in worldviews can also make a difference. In a study we conducted following the 2016 presidential election in the US, we found that patients who disagreed with their therapist's political views rated the alliance as weaker. So that's something worth noticing with your relationships with your patient. So, kind of to summarize it all together, what can we do? First of all, lack of progress or even deterioration is not the end. Psychotherapy is still efficacious, even for those who don't improve at first. We've mentioned various risk factors during this vlog, so it's helpful to evaluate them early on for the patient and for yourself, and check yourself and see how you feel in the session. And establish realistic expectations for the therapy. But also notice if the patient is not making significant progress. And Julian has a great vlog on sudden gains and how significant progress may look. You can also use routine tracking to identify warning signs. We know that assessing the patient multiple times over the course of treatment, every session or even periodically, can improve outcomes significantly, reduce dropout, and reduce the negative outcomes that we spoke about. As always, seek supervision and feedback when things are not getting better. Therapy can be a pretty lonely experience for therapists, and it's really important to feel supported yourself, not just supporting the patient. Be responsive and flexible and adapt to the patient's evolving needs over the course of therapy. And most importantly, ask the patient what they think. Ask them if they feel like they're making progress, if they have a feeling that you are on the same page. And therapy is a dynamic and iterative process, and there's hard moments, and there's moments to grow and learn something about you, about the therapy, about the therapist, about the patient. So think of whether some of these things came up for your sessions with your patients recently. And I invite you to follow our YouTube channel and check out our other blogs and subscribe, and let us know what you think, whether you had some of these experiences, whether some warning signs seem more relevant than others. We'd love to hear from you. Thank you. See you in the next vlog.